Okay, well, good morning, everyone. If we haven't met, I'm Dennis Craig, acting president. Today has finally arrived. About 83% of our 650 students have checked into resident halls. Things are going very well thanks to our staff. Today is really a culmination of a lot of hard work and a lot of efforts. I wanted to take a minute to thank our COVID response team co-chairs that have been leading this effort just a few days into my arrival back in October. The team they led has done really incredible work in a short period of time. And Limor Kahanov, our provost, and Julie Piscatello, our VP for operations and chief financial officer, led those efforts. Also, a call out if Tracy Ranieri is still here. Tracy's been, in addition to being director of our Division III athletic programs, running the testing center, which is really quite an incredible operation. We can, at max, have about 900 people come through here to do testing. So really quite a turnaround from how the academic year started. I wanted to just briefly highlight some key points of our plan that we're really focused on keeping our community safe. And really, I also wanted to mention just coming and parking in front of my office building today, seeing students walk around. We really miss them. They are the spirit of Oneonta. And seeing them reconnect with the academic mission of the college, get closer to earning their degree, really looking forward to that. So a few key differences in our plan. One, as we pointed out on several other occasions, this will be a very low density in-semester experience. So generally we'll have anywhere upwards of, in the spring, about 6,200 students in classrooms on campus. About 20% of our students will be having an in-person experience. It's 1,500 actually in numbers. Students will be having one or more in-person courses. About 650 students living in the resident halls, and somewhere between 1,800 and 2,100 students or so that never left Oneonta. It's their home. They have a lease in the city or the town, and there are students as well. Testing, I think, has been a big advantage for us in getting this spring semester started, requiring testing, a negative test for students prior to return, and having testing that's done on a weekly basis, which has become a standard for SUNY. That'll help keep our community members safe as well. Our code of conduct, there's uniform sanctioning that was approved and put into place on October 1st. At this point in the pandemic, I'm optimistic from hearing from a lot of our students that they take what's going around them seriously, and they have a civic duty to keep themselves and everyone else safe. Our Chancellor is visiting here today, Jim Malatras, and Jim wanted to share a few words. Thank you.
Good morning, almost into afternoon. Today's a really great day to be back in the city of Oneonta. I know we've had some difficult times here, but it is just wonderful to see students back on this campus, seeing the staff work so hard, seeing this highly efficient testing operation that they have here that is automated, which they have stood up. It really is a testament to all the tireless work that has been going on here for many months. I want to thank the leadership here of Acting President Craig. When we called on him to do this job, it was a really big and important job because Oneonta is one of our important campuses in the SUNY family, and he stepped up in a major way, and I think his leadership has shown through over these past couple of months in his entire leadership team. I'd like to thank, in particular, the public officials who have been working with our college campus. Mayor Herzig has been a really important person in this. He has stepped up for us. He has worked together with us, and he has been constantly with us through all of the challenges. So I appreciate his work, as well as the health officials here, which is really important because this really comes down to public health. Diane Gorgeson, who has been instrumental in helping us, her work and effort in managing the crisis for the county and also helping us through this all. She deserves a lot of recognition as well. And then finally, this is really about the students. This is only a college when there's students here, there's activity, there's life. And that's the best part of this all. That's why I'm here as Chancellor, to see students succeed in life, to enjoy their college experiences. And we're joined today by Gabrielle Cesare, who is the student president, assembly president for the Oneonta campus, a psychology major, I believe, just like my wife was. And I think she'll have a great career, and she's been phenomenal in representing students' voices, bringing students' concerns back to the leadership here, and making sure the plan works not just for the community, but also for the students who are here. A couple of points. President Craig said it. They have brought students back. We weren't sure if we would have a plan in place for spring that would allow for in-person classroom instruction after what we experienced here in the fall. But they worked, they rolled up their sleeves, they worked together, and they got it done. The plan, I think, is a smart plan. It includes fewer people on campus. We hope for the final time, as we're finalizing this chapter in our histories on COVID. We have seen testing. One of the things I like to reiterate that President Craig said, we have increased by system-wide policy testing on all of our campuses. We recently put out new guidance to require every student, faculty, and staff member on any of our campuses get tested every week. Every campus has to test, but now we're requiring every person gets tested every week. The numbers were a little elevated for COVID. We want to make sure we can monitor what's going on campuses, and testing has been the secret sauce in being successful on our campuses. So that is spring guidance, an amendment to our spring guidance, which we are happy about. And I thank Upstate Medical for all their hard work, because they are doing most of the testing for the campuses across our system, and it's been really meaningful. The saliva test that we're using, I say it, but I can't say it often enough. It is the #1 ranked saliva test in the world, according to the CDC. That is SUNY Upstate's saliva test, #1 saliva test in the world. So we know we have a good test that can really monitor this virus and do it quickly. A couple of other final points is we have also opened up our volunteers. We asked our healthcare students all across the system to volunteer either with the vaccination process, of which 34 of our campuses are now participating in the vaccination process with the counties or the state. That is a big step forward on the vaccination process, because ultimately that's what gets us through this. About 2,500 students have already signed up to be volunteers. We're allowing those students not only to help with the vaccination process, but also the testing process on our campuses, because many campuses doing 100% a week, that is a big lift for them. So we want to make sure that they have enough staff to do that as well. Interestingly enough, we're at a little bit of a different point in our time with college campuses. I think college campuses have been unfairly criticized in many cases. You've seen studies where they say college campuses have been the vectors of spread in community. What you come to find out, and if you look at the data at SUNY at least, given our protocols, we put together a really tough, comprehensive plan for keeping our campuses open. Mandatory testing on all of our college campuses, regular screening of all of our students. Masks have to be worn at all times, no matter if you're socially distanced or not. Uniform compliance documents. Unfortunately, a few of our students early on violated the rules, which led to spread. We have sort of gotten rid of that problem by uniform compliance. To date, since the beginning of September, SUNY now has conducted more than 724,000 tests. Our positivity rate is 0.57%. It is the lowest, if you were a state, than any state in the nation right now. So the early concerns early on with colleges was college students would be bringing the virus back to the communities. We now have the inverse problem. Many of our students, we have to be mindful of, is that the community's positivity rate outside of our college walls are actually much higher. Otsego County, for instance, right now, Otsego County on the 7-day rolling average, about 5.5%. Today's positivity rate was 6.7%, compared to our positivity rate of 0.57%. All we're trying to say is we're all in this together. We're doing our part by testing all of our students. We will continue to work with our community leaders, because it's important that we have good relationships there. And I am confident that the city of Oneonta, the college here, will have a highly successful semester. It will be a much different experience, and I'm looking forward to seeing this play out. But I just want to give applause and thanks to all the hard work of this entire community. And it's a great day to be back while we're reopening after all of that we went through in the fall. And with that, we'll take questions. Tough ones go to President Craig. I only take the easy ones. I'll let President Craig talk a little bit more about that. We have Chief Fila here. She was somewhere here early on. The UPD police department here has been phenomenal. I visited the chief's force on Thanksgiving. They were here working hard on Thanksgiving because they still had students who had nowhere else to go on Thanksgiving. They have partnered very closely with the city of Oneonta's police force. We're going to be doing more regular check-ins of our students to make sure everything's going okay. The best thing is, if you're going on campus today, you have to be tested. If you look at this operation here, it's all automated. The students' cards, it's all automated, so we know who's being tested, who's not being tested. So if students aren't being tested, even though they're not living on campus, but they're coming to campus, we will know that and be able to remedy that. But I think the relationship between the university police department and the city police department is tight, and I think that's an important relationship to make sure that we're taking care of each other and monitoring the situation outside of our campus borders as well. I mean, listen, this, on some level, you saw this with the growth of the positivity rate in the state during the holidays. It comes down to personal responsibility. You can put all the rules in place, but if people are unwilling to follow the rules, positivity level goes right through the roof. And you saw that during the holidays. Our positivity rate in the state of New York on a 7-day average got to about 8% after Thanksgiving, after Christmas, after New Year's, and now it's coming down. I think the students that I've been talking to here, they wanted some assurance because, let's face it, it was a small minority of our students who weren't complying. But a small minority can have a big impact on everyone else. I think our students collectively said, wait a minute, we all have to be in this together. Let's all focus on testing. So on our part of the bargain as administrators, we said we'll put rules in place and we'll be tough on those rules. Those compliance rules are not easy, and there have been consequences to students who have violated those rules. Let's put a testing system in place. I think this is a very sophisticated testing operation they have here. President Craig and his team should be applauded for how sophisticated this testing operation is. And then on the student side, with Gabby and others, our leaders here, they're going to keep reinforcing, we're back. Let's stay here. Let's not go home. I think this is going to be a far different semester than last time. And one other point on the students, because you don't want to always, it's not always about the students. You have to put a structure into place that allows students to be successful. I do think there were some kinks in the plans in the fall, which allowed for some of those problems to emerge. I think President Craig came in here with decisive action, bringing the community together and said, let's put together a plan where everyone can be successful. Our students can be successful, our faculty and staff can be successful, so we can stay on our campus. I think that all the ingredients are now here. Now let's implement it and see how it goes. Good. Anybody want to fashion how much the Bills are going to win by? So right now, we don't get to choose who gets vaccinated, who does not get vaccinated. We did advocate that our in-person staff and instructors, our faculty, be included in 1B for the state's allocation. Our in-person faculty qualifies currently. We are advocating to get more of our staff who are in person to be vaccinated as well. This comes down to, though, as a matter of supply. You can say everybody is eligible right now, but there's 7 million people currently eligible under the current rules, but only 1 million vaccines available. So there's already a disconnect. I think what we're urging, the state has been urging, is to increase the number of vaccines available to the state, and then we begin to vaccinate as many people as possible. I'm confident about that. In the meantime, as we're vaccinating our communities, it's also important to see how it's going on our campuses. That's why we're mandating 100% testing a week, right? You have to balance the public health. Vaccinate, test. You see what's going on there. We're going to do both of those. So yes, we're going to keep advocating for as many of our in-person staff and instructors to be vaccinated. And I'd like to say we've been working very closely with UUP, which is our labor union. President Cole and I have been working very closely together on this, and he's been a really good advocate for us on that point. Not right now. The good thing is, what we're happy about, he asked about the new strains, the UK strain, the Brazilian strain. They're finding them to be more transmissible, which is problematic. They are looking at if they're more deadly. I think there's a little bit mixed data on that point so far. The SUNY Upstate Medical saliva test picks up all strains. So the good thing is we'll be able to know if we have those strains on our campus because we can pick up those under our test. We're working with the state health department to see how that's going. Right now, I think they've been updating it something like 25 to 30 people in the state of New York who have tested positive with those strains. But that is something to monitor for sure. So if someone tests positive, you have to isolate pursuant to state health orders, right? That's not an option for us. You have to isolate for at least 10 days. They have changed the timing a little bit because they found that you're shedding the virus a little earlier now. What we do on campus, and President Craig can talk more about the specifics, we required all of our campuses to have available space for those students to isolate safely if you have the virus. If you've been exposed to the virus, we also require that space is set aside for those students to quarantine. Quarantine is if you don't have the virus, but you may have been exposed. Isolation is if you've been actually tested positive and you must isolate. So we have that on our campuses, meals, things like that. We're always improving upon that process, but that's been set up for sure.
I would also add that we have dedicated staff that provide oversight when students are in those spaces, including staff delivering meals.
Thank you.